Hello, good afternoon, good morning, and good evening to everyone who is joining our today's session with Dr. Maria van Kerkhove, who is now in a new role, Interim Director for Epidemic and Pandemic Preparedness and Prevention. Maria, thank you for finding the time for one more social media live conversation on COVID-19 and flu. I will just remind our viewers that they can ask their questions if they are watching us on X by using the hashtag AskWHO. If you're watching us on other platforms, please use the comment section and I will pass your questions to Maria. Maria, once again, good afternoon to you. Thank you for your time. As I said, you are in a new role, and what does that role now include? 'Cause you are the COVID-19 expert, but this sounds more serious in like epidemic and pandemic preparedness and prevention.
Yes, so thanks, Alex, for having me back, and it's good to do another live on COVID and also include flu this time. So yes, I'm in a new role of the interim director. I was in this department before, leading our work on emerging diseases and zoonoses, and also the COVID-19 technical lead. But this department covers epidemic and pandemic prevention and preparedness. And essentially what we do is we try to bring together all of the world's technical expertise on these types of pathogens that pose a threat to cause epidemics and pandemics. We cover a range of different type of pathogens, including influenza, other respiratory viruses and coronaviruses like COVID-19, MERS coronavirus. We do orthopox viruses, we do some bacteria, we do arboviruses. But we also not only tackle these biological threats, we also look at biosafety and biosecurity in terms of the labs and lab systems. We look at deliberate release. We look at a number of different type of areas of work. And we have a number of cross-cutting functions, looking at infodemic management, public health and social measures, and many others. I didn't mean to list some and not list them all, but it's an incredible department within our preparedness division in the health emergencies program. And I'm really proud to lead these incredible group of people.
Thank you so much, Maria. And now going into the conversation for today,
Sure.
We haven't done these sessions in a while. So let's start with the epidemiological update. Is COVID still a threat? And if yes, are there specific places that people are at risk of infection in particular?
Yeah, so it's good to touch base on COVID-19. This virus, SARS-CoV-2, is circulating in every country right now, and it still poses a threat. The threat is different than it was in the beginning of the pandemic in 2020 because we have so many interventions that we have used to increase population level immunity that provides protection against severe disease and death. But we have to remain vigilant because the virus is circulating, it's evolving, it's changing, and we have to make sure that we use these tools that do exist to keep people safe. Tools such as masking when you're in crowded areas, if you're in an at-risk group in particular, improving ventilation, physical distancing where possible while we keep our societies open. But really critically, using vaccination for those who are most at risk for developing severe disease, using diagnostics and therapeutics so that people get the clinical care that they need. So there's a lot of areas of work that WHO is continuing to work on in the context of COVID and everything else that's happening in the rest of the world. So it's still a threat, not the same level of threat as it was before, but it's something that we'll remain focused on. And I know we have some questions that come up around post-COVID condition because we're worried about not only the acute infection and disease that it causes, but the long-term effects as well, including post-COVID condition.
Thank you so much, Maria. We're already getting some follow-up questions from Mahmouda Mooni, watching us on X. Is asking if there's any change of symptoms. Vaccination effect is how long? And there's 3 questions here. We'll come back to some of those, but maybe let's start about any change of symptoms.
So this infection causes the full spectrum of disease. We hear a lot of anecdotal information about some symptoms being more common than others. What we can say is that infection with this virus and any of the variants that are in circulation can cause everything from asymptomatic infection, where you have no signs or symptoms, all the way to severe disease, pneumonia, and death. Luckily, most people are experiencing more, not as severe symptoms because they have population level immunity from vaccination or prior infection or both, but also because we have access to clinical care. we have earlier diagnostics, we have antivirals that can be used. So the impact in terms of the proportion of people that were experiencing severe disease is not the same as it was before. But I hesitate to say that it's more mild because it's not the virus that has really changed. It's our interventions that have made you better protected.
Thank you so much, Maria. We're getting a few interesting questions. Before we get into those, I want to ask you about an update on variants that are circulating.
Yes.
And is there any variant that you're concerned about in particular?
Well, we have several variants that we are tracking. So this is a system that has been put in place for the last 3.5 years, almost 4 years now, to track SARS-CoV-2 variants. We have 3 variants under monitoring. 3 variants of interest and several variants under monitoring. Actually, today we're going to be publishing an updated risk evaluation for EG.5, which is one of the variants of interest. That represents about half of the sequences that are shared globally. And so that's an important one because it's circulating in a number of countries. We do not see a change in severity of EG.5 compared to the other sublineages. Today, we're also going to be issuing a risk evaluation for BA.2.86 and its sublineages. Previously, it was listed as a variant under monitoring, but we're now classifying this as a variant of interest. And the reason for that is because we've seen a slow and steady increase in its detection around the world. And this is the system that we have in place. By characterizing it as a variant of interest really helps to promote surveillance for these types of variants around the world, as well as to stimulate research to understand what this virus does in terms of its growth advantage, its immune escape, and any impact of our interventions. I can say for BA.2.86 and its sublineages, including JN.1, for those of you who track these very, very closely, we don't see a change in severity compared to other Omicron sublineages. We still have very few sequences around the world, around 3,000 or so, in terms of how many have been reported to us. And so it's important that we use the system in place. We have variants under monitoring, variants of interest, and we had variants of concern before. We don't have any classified as a variant of concern at present, but this is what is needed for us to track and to detect and to work with our technical advisory group for virus evolution to assess each of these. So that will be published later today.
Thank you so much, Maria. We're getting quite a few questions about long COVID, and I'm going to come to that. But first, I would like you to clarify for our viewer on Facebook. His name is Jason Munian. Do you think the virus will be back?
Oh, Jason, that's a good question, but the virus is here. And so we may not be hearing about this virus in the news. Certainly, it's not center stage anymore. But the virus is here and it's circulating in every country. And this is why we're working with our member states, with our governments to ensure that there are provisions in place, that surveillance continues, that you have access to diagnostics so that if you are infected, you know it and you can get the right clinical care because there are antivirals that exist. We're working with governments to ensure access to these materials because they're not available everywhere. And we're working with governments to ensure vaccination continues to make sure that we focus on the most at-risk people in all countries. But when it's your turn to be vaccinated, follow your local guidance, get vaccinated. And there are many updated COVID-19 vaccines that are now available. And even the vaccines that are based on the ancestral strain still provide protection against severe disease and death for all of the circulating variants.
Thank you so much, Maria. Here's the next question from Abdul Mahmoud watching us on LinkedIn. Is it true that any pathogen that spreads rapidly are less toxic or harmful as in case of the recent COVID?
I think I need some clarification for that question. So we look at a variety of pathogens that are circulating. There are many known pathogens. Some of these transmit very efficiently between people through the air, like respiratory pathogens, like COVID, like influenza. There are other pathogens that transmit through touch or through blood products. And so we look at a number of these. Any pathogen that has the potential to spill over from animals to humans or infect humans, cause disease, are something that we care about. And it's something that we work with governments to ensure that people are protected from. What we want to do in any case is prevent infections from pathogens with epidemic and pandemic potential. But when people are infected, if they get infected, to make sure they know how to get the right care so that we can save lives and we can save livelihoods as well.
Thank you so much, Maria. I'm coming back to our first viewer who sent questions, Mahmoud Amouni, who had another question about how long does the vaccination effect last?
Yes, so I didn't answer that the first time around. So there's a lot of information coming on looking at vaccine effectiveness and looking at the population level immunity or individual immunity over time. It depends, is the short answer to that. But we do know that there is protection against severe disease. There are different outcomes we look at. We either look at protection from infection, and vaccines work okay for that, but that's not their primary goal. The goal of vaccines for COVID-19 is to prevent severe disease and death. And for many people, when they have vaccines, if they've had a number of doses, within 6 months to 12 months, that protection lasts against severe disease and death. It does depend if you're in an older age group, if you're in the oldest age group, over 75, over 80 years old, if you have underlying conditions. Our recommendations for the highest risk groups is to get an additional dose to be revaccinated within 6 to 12 months. So it's not just important that you have been vaccinated, but when were you vaccinated? For us, according to our SAGE recommendations, among the highest risk groups, again, these are older individuals over 75, 80 years old, or older individuals with underlying conditions, to get an additional dose within 6 to 12 months.
Thank you so much, Maria. And here is the last question from Mahmouda, is if you can provide an update on long COVID research.
So long COVID, post-COVID condition, as we call it, is of critical importance to us here at WHO, and we're managing this within our clinical management team led by Janet Diaz. But across the house, we're working with many different groups in terms of rehabilitation, mental health, to ensure that, number one, there's good recognition for post-COVID condition. We've issued some guidance related to case definitions or an ICD code so that it can be recognized in countries to better understand the burden of post-COVID condition. We don't have great estimates, but there is one meta-analysis that suggests 6% of symptomatic individuals suffered from post-COVID condition. That those individuals are suffering from many different effects of organs, the brain, the lungs, the heart, from a period of between 4 and 12 months. Many people do recover after 12 months, but there still are people who are suffering significantly from this. They can't work. They have many different, living daily life is becoming very difficult. So the second area of work that we're focused on is really looking at rehabilitation, looking at clinical treatment, looking at proper clinical care across the different organ systems to have a comprehensive approach to this. So we're working with medical professionals around the world to develop therapeutic guidelines, clinical guidelines for people with post-COVID condition. And then the last area we're working in is to develop research studies to really make sure that it is on in the forefront of governments to be able to say, this is something we have to invest in. We know very little about post-COVID condition. We know very little about the long-term effects of infection and repeat infection from this virus. So we have to invest in research so that our evidence base and the guidance that we issue is the strongest and most robust so that it's helping people around the world.
Thank you so much. We have a viewer, Rene Samarj, who is watching us on LinkedIn and asking a question about post-COVID condition twice. What can we do to get the word out that the vaccines can reduce long COVID incidence only slightly?
So she raises a very good point that we do have evidence that vaccination with COVID-19 vaccines does reduce the risk of post-COVID condition. That's a key message that I should have mentioned in my other answer before. Not only does vaccination prevent against severe disease, the acute disease that you have and your risk of hospitalization, but also from these longer term consequences like post-COVID condition. So vaccination is one really important tool that we have at our disposal. And that's pretty incredible. You know, we're still learning about this virus. The virus is with us, it is circulating, and we have something that can mitigate its impact. But not only vaccination. I want to be really clear about this because sometimes I get feedback of people saying, Maria, why are you only talking about vaccination? WHO, why are you only talking about vaccination? And in fact, we're not. You know, from the start, we've had this comprehensive approach to tackle this invisible virus that is around us. And we're in a much better position now at managing it. We just have to keep it up. We have to be vigilant and we have to support governments in making sure that you have the tools that you need to keep yourself safe.
Thank you so much, Maria. Isabel Jacquet, watching us on LinkedIn as well, is asking about what about long COVID treatment?
So that's a good question. So we have a whole portfolio of work on this and looking specifically at certain medications, certain therapeutics. And the way that we evaluate this is we bring together what we call a guideline development group. We bring together expert networks, clinicians, and experts from around the world to come together and assess the available data that we have, looking at the impact and if it can prevent or treat people with post-COVID condition. There are challenges that we face with this. Number one, there's a lot of people that are using long COVID or post-COVID condition or different phrases. And for us, we need to make sure that we have a good clinical definition of this. And this is why our case definitions are so important. And then we look at the different types of studies that are evaluating these treatments. It sounds perhaps like a cop-out of an answer, but for us, what is really important is that we actually evaluate these therapeutics on their value of preventing post-COVID condition or treating people with post-COVID condition. And that takes a little time. We're trying to accelerate this to make sure that we have good research that can be assessed by our expert groups. And that's something that's ongoing right now in the background. So even though it's not in the news every day, this is something that our teams are constantly working on. We have not forgotten about COVID, even though no one really wants to talk about it, and then I completely understand. But our work on COVID and influenza and Mpox and many other diseases continues because we want to make sure that we have the right evidence base to support countries in helping you.
Thank you so much. Here's a question from David Sani. How can we effectively manage and prevent the long-term effects of COVID-19 and other associated health complications?
So the first thing we want to do is prevent infections as much as we can. And so some people say that's just not possible, but we beg to differ. There's a lot that we can actually do to think about our exposures. And it doesn't mean changing the way that you live your life or going out and living your life on a daily basis, but it's about the decisions that we make. It's about making sure that we're vaccinated. It's about making sure that those of us that have access to tests, especially if we're visiting someone who's vulnerable, that could develop severe disease, our loved ones. We have some holidays that are coming up in the new year, making sure that when we gather, that we do it as safely as possible. We're not saying to stop doing different things, but making sure we have good ventilation, making sure if you're feeling unwell, definitely test before you go. Wearing a mask when you're in super crowded conditions, if you're in public transport, it doesn't take much these days to wear a mask. And I don't always wear my mask when I'm in crowded situations, but I still do. And I still get people who give me some funny looks. But it's really about protecting me and my family, because if I was infected, I wouldn't want to pass it to someone else. So we really want to prevent infections where we can, but also utilize tools, diagnostics, therapeutics, vaccines to prevent severe disease. So a lot of different things we can do.
Thank you. We have a next question from Brittany Scott. It's a very important one. Is it worth getting the vaccine now if a person has never been vaccinated?
Absolutely. It is really important to get vaccinated, especially if you have not yet been vaccinated. There are many safe and effective COVID-19 vaccines. In fact, the world has administered 13.5 billion doses of COVID-19 vaccines since the start, since 2021, late 2020, early 2021. And they have a very strong safety profile. They prevent severe disease and death. We do know that people who've been infected in the past do have some protection. They've built up some immunity, but we know that a dose of vaccine actually provides hybrid immunity, and it is even stronger protection against severe disease and death. So yes, absolutely. When it's time, if you have access to them and you haven't been vaccinated, please do get vaccinated for COVID.
Thank you so much, Maria. Here is another question from Renee. I have read that COVID is evolving resistance against Paxlovid. What other treatments are in the works?
There's a number of treatments that are available for COVID-19. And Paxlovid is one, these antivirals that are not available in every country, and we need to increase that availability of these antivirals to prevent severe disease. And there's a system that is in place that is looking at resistance. This antiviral continues to work and continues to provide protection against developing further disease, needing hospitalization, admission to ICU, and dying. So that's an important therapeutic that continues to work. But we also have other therapeutics that are out there. Our guidelines, we'll put in the chat a full list of these. We have corticosteroids, which are widely available and inexpensive around the world. We have a number of other therapeutics that are We recommend, depending on your risk profile in terms of if you have underlying conditions, your age. I'm not a medical professional, and I always careful about not giving medical advice, but that's why we have this guidelines out, and it's in its, I don't know if it's in its 12th or 13th edition, because we're constantly updating these. We have living guidance, which means we update each section when new data become available. We could put that in the chat, and you can see all of the therapeutics that are available.
Thank you so much, Maria. We'll do that post live. We have another question from someone watching us on Facebook, Che Vizal. Does one patient can cause the sickness by both COVID-19 and flu at the same time?
Can they be infected by
Right.
both? Yes. So you can. We have a number of pathogens that are circulating, and you can be infected with both SARS-CoV-2 and influenza. We have had instances of co-infection, and it's certainly possible. Many people don't test for flu. Many people aren't testing for SARS-CoV-2. So it's possible that you can have co-infection with both. So it will depend on your underlying conditions, about your risk of developing severe disease. It will depend, in terms of the outcome. If you've been vaccinated for COVID, but remember, we also have influenza vaccines that are recommended for people who are of older age. It's the same risk groups. So if you are recommended for a flu vaccine, please get your flu vaccine. Please get your COVID vaccine. And I should give a special mention for those of you that live in the northern hemisphere in the temperate regions. We're well into autumn. We're starting our winter months. It's getting colder. People are spending more time indoors. It's really critical that you get your vaccine now for both COVID and influenza. I had one the other day, the same arm on the other. I got them both at the same time, and I'm very privileged to have access to these vaccines. And I urge you to get vaccinated for both COVID and influenza when it's recommended for you.
Thank you, Maria. We are getting a question from someone watching us from Texas in the U.S. With the name Cybel Merich. What is the link between COVID-19 and the flu?
The link between the two? Well, both of these are respiratory pathogens, meaning they transmit through the air, they transmit efficiently between people. They have similar symptoms, similar signs and symptoms. They can cause the full spectrum of disease, from everything from asymptomatic infection to severe disease and death. But there are some slight differences. They're different viruses. They behave a little bit differently in terms of their evolution, but they're both really critical pathogens. Influenza, we have seasonal influenza every year. You've heard of avian influenza, which is a zoonotic pathogen. It's highly pathogenic. There's highly pathogenic form and low pathogenic form in birds. And those viruses can spill over from animals, from birds into mammals. And we've seen an expansion of a subtype called H5N1 over the last 4 years. And we also have pandemic influenza. For those of you that remember, we had a flu pandemic in 2009. And so as part of our global influenza program, we have a global system of surveillance and response, GISRIS, the Global Influenza Surveillance and Response System, which has been in operation for 70 years, and it's tracking these viruses around the world. COVID is a different virus. It's a SARS-CoV-2 virus. It's a coronavirus. It spreads similarly, and it affects everyone in terms of who it can infect, just like flu, and it can cause the full spectrum of disease. We are now setting up a system globally, which we have in the last 4 years, to track coronaviruses and to make sure we understand how it is evolving and changing and what it means in terms of our interventions. So it's a good question. There's a lot of similarities between the two, but they're different viruses. There are different therapeutics and interventions that can be used in terms of medical interventions, but the basics in terms of strong surveillance, good clinical care, community protection, looking at public health and social measures, addressing misinformation, using vaccines, all of those types of elements are really critical for influenza like they are for COVID-19.
Thank you so much, Maria. And when we are now entering into conversation about the flu, maybe you can tell us how much is flu spreading at the moment?
Yeah.
It's flu season in the northern hemisphere. So how concerned are you about the virus at the moment?
Well, influenza is one of those pathogens that, because it's seasonal, we see it every year. Maybe people don't think it's just something that's common, but it does cause significant morbidity and mortality around the world, particularly in people who are of older age, and pregnant women, and in the very young. And so it's something that's on our radar to be able to protect each year. Our global influenza program actually updates vaccines for influenza twice a year. They do it once a year for the northern hemisphere, and once a year for the Southern Hemisphere. And they look at all of the circulating viruses and they come together and say, what does the vaccine need to look like for the upcoming season? That's why you have to get vaccinated every year, wherever you live. And in the Northern Hemisphere, as you've pointed out, we've seen some increasing trends in terms of influenza and hospitalizations. So I'm looking at my cheat sheet because it's a lot of information. But our influenza activity, including the influenza-associated hospitalizations, has started to pick up in a number of countries. And so that means that the hospitals are dealing with influenza patients. And if you're dealing with influenza patients and COVID patients, those beds are not available for other individuals. So we want to make sure that they get the right clinical care. Vaccination is the best way to protect yourself against influenza. But similar elements, stay home if you're unwell, get tested, get clinical care, apply for influenza as they do for COVID-19.
Thank you so much, Maria. Some of our viewers are appreciating that you're reminding them about the use of masks, but some are also asking, why aren't you and I wearing a mask at the moment?
Yes, so we get this question a lot every time we do one of these lives. So masks are one of the important measures to prevent the onward spread, but also to protect from infection, especially if you're in an at-risk group or if you're a health worker, for example. There's many reasons why right now we're not wearing masks, and it's comprehensive answer. So part of it is that we're in a space that is quite spacious and we have good ventilation within the building that we have. You and I don't know how often you test. I don't test nearly as much as I used to, but I do test every time I feel symptoms or I'm feeling a little bit unwell, because I'm fortunate to have access to rapid diagnostics. We're also vaccinated, a number of different reasons. But I have to say, when I travel, and I travel with my family, not every time, so I'm not perfect, but we do wear our masks when we're in crowded spaces like airports, because, you have to queue up and you have to be, or if you're on public transportation or whatnot. So I myself utilize, and my family, and my extended family do utilize some of these additional tools. So you may not see us wearing masks right now, but there's a number of other provisions that we actually have in place to make sure that we're safe and we're protected.
Thank you so much, Maria. Here's an interesting question from a viewer on Facebook. Is there any risk of combination between dengue and COVID-19 virus in least developed countries?
So dengue is another virus that is circulating, and I don't have the exact numbers in front of me, but there are more than, I think, 30 countries that are dealing with dengue outbreaks at the present time. In terms of the mixing of the virus, that's not anything that we are seeing, but you could live in an area where you have both COVID and dengue, SARS-CoV-2 and dengue infection, and you could be infected with both. I don't recall reports of co-infection with those, but it doesn't mean that it's not possible. But you do raise an important question. Again, I mentioned respiratory diseases, but one of the other areas of work that's really critical for WHO are arboviruses, or viruses that are spread by mosquitoes. We have dengue, we have yellow fever, we have chikungunya, we have Zika, Japanese encephalitis, West Nile virus. And there are different ways in which you can protect yourself against those types of pathogens, whether it's wearing mosquito repellent, and depending on the day or the type of mosquito that bites, using bed nets during the day or at night. Some of these pathogens, like yellow fever, have vaccination. So again, it's a great question to remind us that there are other threats that we face. But in countries that are dealing with both dengue and SARS-CoV-2, we as WHO are working through our regional offices and our country offices to support governments in dealing with those outbreaks. First and foremost, to try vector control, to prevent those outbreaks from happening, or to reduce the impact of those and bring those to an end, but also to inform people and provide the right type of communication materials to prevent infections in the first place.
Thank you so much, Maria. I think it's important to clarify one more question around masks coming from Sean Stewart. Can you recommend any reusable masks?
There are, so a lot of the medical masks that we have, and the respirators are not the same thing as masks. Those are single use, and depending on those should not be reused. There are some fabric masks that people have produced, and we recommend, if you're going to wear a fabric mask, the 3-layer mask. Some of those can be washed and reused. But I like this question because it gives me an opportunity to advocate for much more research in this space and the development of much better personal protective equipment, especially for women. So 70% of healthcare is actually delivered by women. and most of the personal protective equipment are built for men. So in terms of fit, if you look at, a lot of people have sort of gaps in their mask, but we should, at this stage, we should have much better personal protective equipment. And there are some groups out there that are doing some innovative research on this, but it's not just for respiratory diseases. If we think about the Ebolas of the world and the Marburgs, you've seen those suits that people wear. Those are very, very difficult to wear in some very difficult conditions. We should have better personal protective equipment. So those of you working on that and funding that research, please continue to do so, because the world needs better personal protective equipment.
Thanks, Maria. While you are on advocacy mode at the moment, here's another question. How can we encourage healthcare providers to wear masks and improve air quality in healthcare settings?
So I think we need to improve air quality everywhere. So this is something we're talking a lot about with climate change and health, but this is also very important for infectious diseases. We've seen during this pandemic the importance of ventilation and the investments that we need in better air that we breathe, in the air that we share. So it is healthcare facilities, and there's a lot of work that's happening in the ventilation systems within those. We work with some incredible people around the world that are focusing on air quality, and aerobiologists and engineers that are supporting us in the development of better ventilation within health facilities and different types of health facilities. So we're not just talking about high income buildings, but also in low income settings around the world. But we also need, better ventilation where we work and where we go to school and where we live. Because air quality is really quite important. So not just important for climate change and air pollution, but also for the contaminants and infectious diseases that are circulating through the air.
Thank you so much, Maria. Stephanie Gates is saying, we are prompted to remind patients to get vaccines. I'm frequently asked if being vaccinated keeps you from spreading the virus. Does it?
That's a fantastic question. So yes, we rely so heavily on health workers around the world to not only support patients and provide them with clinical care, but to give them information that they need. And vaccination remains critically important for preventing severe disease and death. That's the main message. But vaccines do impact transmission as well. Not as well as they do against preventing severe disease, but they do prevent some onward spread. But that's not really what they're designed for, the current vaccines, that is. There are some vaccines that are in development that we are aware of, the intranasal ones, that you can breathe in through your nose, that are looking at a different type of immune response that could prevent transmission. That would be a complete game changer. And I would love to see further development of these that actually prevent infection. So primary use of vaccination for COVID-19 is to prevent severe disease and death. They do have some impact on reducing transmission, but they're not perfect.
Thank you so much, Maria. Here's a very important question from Haruna Abdullahi, watching us on Facebook. Can we use same vaccine for both flu and COVID?
So these are different vaccines. There are vaccines that are specifically for COVID-19, and there are vaccines that are specifically for influenza. They're different viruses, and so you need different vaccines.
Thank you, Maria. We're receiving questions about COVID reinfections, and do we know what is the current time frame when the reinfection may happen?
So this is a question we haven't received in a long time. You're reminding me back to the beginning of the pandemic when we were asking the question, can reinfection occur? And of course, we know that can happen. I don't have a firm answer on that in terms of it's within 3 months or 4 months. People can be reinfected. Typically, people are protected against reinfection for at least 3 months or so, or within 3 months. I'd actually have to come back to you on an answer with that, because I don't know if I have an update. The challenge of getting an answer on that is how often people are testing. There's some really fantastic studies. I just came back from a meeting in Hong Kong looking at immunology, looking at immunity of COVID and looking at circulation of the different variants around the world and the number of reinfections. And it's actually more common than I think we actually understand. There's a fantastic study out of South Africa looking at their different waves of infection, the different variants of concern, and now the different waves of Omicron, and looking at how often people were reinfected. And it does happen. So that's why we have to remain vigilant. The thing that we're quite concerned about is not just with post-COVID condition, that we know about, that is recognized, that is real. What we are also needing to work on and to better understand is the impact of repeat infections over time. For example, we may not know that we're infected multiple times because we may not be experiencing any disease because we're protected from vaccination. But we don't know the impacts 5 years from now, 10 years from now, 20 years from now on cardiac function, on neurologic function, on lung function. And that's something that we have to track. This is still a new virus. Even though we feel like we've been dealing with it forever, it's still new and we're still learning. So we want to prevent infections. One, because we don't know about this repeat infection and the risk of long COVID, but also because the virus is changing. The more the virus circulates, the more opportunities that it has to change. And so as this virus evolves and it changes slightly, all of these different mutations, it is a gaining ability to infect you again. That's why we have to remain vigilant.
Thank you so much, Maria. I think we are coming closer to the end. I'll take one more question from our viewers today. How can we empower community members to become active participants in the fight against COVID-19 and promote community-driven solutions to address the pandemic's impact?
It's a fantastic question. So we are spending a lot of time on this. And in fact, right now, we have a meeting on public health and social measures and working with communities. We have teams around the world that are looking at community engagement, community protection, engagement with individuals, listening, empowering, enabling. And this is something we're trying. One of the ways in which we need to learn lessons from COVID-19 is specifically this. Outbreaks begin and can be prevented in communities if they have the right information, if they have the tools and the knowledge to be able to protect themselves and their loved ones. So there's a huge area of work. So right now we're looking specifically at public health and social measures. And we're very grateful for some funding that we received from the government of Norway to really focus on this. In the beginning of this pandemic, we had very little information on which interventions worked and in what order. And we know that while many of these public health and social measures prevented onward infection, they had a lot of detrimental effects in terms of mental health, societal impact, social impact, and financial impact. And so what we want to do is be more precise in the interventions that can be used. And a lot of this information comes from communities. How can this actually be used by you and your communities to have the right and the desired outcome and not have unintended consequences? So huge amounts of work in this space. And this is something we're deeply committed to with partners to be able to have better community engagement with our CSOs, with all of our member states, with many, many different actors.
Thank you so much, Maria. And to end on maybe positive note, as holiday season is approaching in many parts of the world, starting with Thanksgiving later this week, what would be your advice to people who will be traveling, celebrating, how to minimize their risk of COVID and flu in upcoming months?
Yeah, so there's many reasons to celebrate together with family. Especially in this global context of what's happening around the world. I know it's important to reflect and take a moment to celebrate the times we can, for those of you who can. So it's important that you do take care while you are traveling. For those of you that need a vaccine for COVID-19, please get vaccinated first and foremost. Same thing with influenza. If you're in an at-risk group, please get your influenza vaccine. Older age groups, pregnant women, immunocompromised, please. That's really critical. And while you're traveling, if you're in crowded situations, bring a mask. Make sure that you wear that mask in those crowded settings, you and your family. It's a minor precaution. It's a minor inconvenience that you can have. If you are feeling unwell, certainly test yourself before you go into groups with others, because you don't want to infect somebody else. It's not just about you. It's about protecting the loved ones who you're sharing those holidays with. And if you're in indoor spaces, many people in the northern hemisphere, it's colder. Those in the southern hemisphere, it's your summer months, and so you can do more things outdoors, and those of you in the tropics. But use ventilation as much as you can. Open those windows and doors. So it's a number of things. But if you are unwell, it would be good for you to stay home, get yourself tested, and get yourself care. Whether it's from influenza or it's from SARS-CoV-2, there are treatments that are available that can keep you from developing severe disease. But I wish everyone a very happy holidays, safe travel if you are traveling, and happy Thanksgiving to my family and friends in the U.S.
Thank you, Maria. Happy Thanksgiving to your friends and family in the US. And also my huge thanks to very active audience today, because these questions were all coming from our viewers. There are some maybe that we didn't cover today, but we'll make sure that we cover either in a different format or next time. Thank you all for watching us from India, South Africa, the US, Morocco, the UK, Mexico, Bangladesh, Nepal, Nigeria, Uruguay, Sierra Leone, Ethiopia, Germany, the Netherlands, Madagascar, Canada, Argentina, Pakistan,
Wow.
Senegal, Somalia, DRC, Haiti, France, Uganda, Kenya, Ghana, Zimbabwe, Brazil, Malaysia. Long list. Thank you once again for the latest updates on COVID, flu, and other health conditions. Please continue to follow us on our social media channels or our webpage. And until next time, please be safe.